Good morning, ladies and gentlemen. I extend my warm greetings to you all and my thanks to the organizers for their invitation. Today, I want to share my belief in the importance of health and safety at work, especially in today's economic and social climate. Since the 1987 Single European Act, the treaties of the EU recognized that the EU and the member states share competence for policy initiatives in the area of occupational safety and health. Thanks to combined action at EU and national level, a shared culture of prevention has developed over the last 20 years. A major body of legislation has been put in place, and the member states have worked to implement and enforce it consistently. I would like to mention that today the European Commission has adopted a proposal to better protect workers from risks linked to exposure to chemicals at the workplace. The social partners in Europe play a key role in devising and implementing health and safety policy at both national and EU level. Social dialogue in particular has offered a sound basis for making improvements in this area. Furthermore, EU health and safety strategies adopted in 2002 and 2007 have helped to consolidate a holistic culture of work-related accidents and disease prevention. As a result, accidents at work are at a historically low level, and the EU's occupational safety and health standards and performance are a global reference for the international community. So we have made a lot of progress, but I would like to say that the current situation is still not satisfactory. Although they were much lower than in previous years, the numbers of non-fatal and fatal accidents in the EU in 2010 was still very high. The latest Eurostat estimates put them at almost 4,400 fatal and over 3.3 million non-fatal accidents. But those data cover 26 member states only, and they do not cover all accidents. And they only include serious accidents resulting in more than 3 days absence from work, so they tend to underestimate the facts. According to an ad hoc module of the Eurostat Labour Force Survey covering the 27 member states in 2007, 23 million persons aged 15 to 64 who were working or had worked before reported a work-related health problem in the previous 12 months. This is approximately 1 in 10 members of the EU workforce. And work-related health problems were estimated to have resulted in at least 367 million calendar days of sick leave. Those cases of work-related accidents and ill health translate into substantial costs. A study by the European Agency for Safety and Health at Work puts it at between 2.6 and 3.8% of the GDP. So the question is whether we should accept such high costs in Europe. My answer is no. Is this acceptable situation? The answer again is no. And do we have means to improve the situation? The answer clearly is yes. However, we're still very often confronted by skepticism and opposition to occupational safety and health efforts, which is based on certain myths rather than the reality. For example, some say that sound health and safety at work management is too expensive for companies, especially for SMEs. Or the EU over-regulates and over-inspects in this field. You also hear people say occupational safety and health imposes a heavy administrative burden on business and is an obstacle to the EU's economic competitiveness. What I want to do today, ladies and gentlemen, is debunk some of these myths and give you some objective facts. The first myth claims that occupational safety and health measures are just too expensive and involve too heavy an administrative burden. But the evidence is that systematically applying well-planned safety and health measures can bring a significant return on investment at company level. According to a 2011 Commission study, the median value of the profitability index, that is the ratio to payoff to investment in a particular project, ranges from 1.29 to 2.89 for investments in occupational health and safety. Apart from reducing costs related to absenteeism, accidents, and disease, occupational safety and health measures also help to improve the company's image, its position on the labor market, and consumer satisfaction. They also reduce employee turnover and increase productivity. Academic research also shows that high-quality working conditions that trigger job satisfaction may indirectly influence workers' health, and that improvements in job satisfaction over the time appear to stop workers' health deteriorating. Occupational safety and health policy at EU and national level contributes significantly to reducing work-related accidents and ill health. For example, from 1994 to 2010, there was a 56% fall in the incidence rate of non-fatal accidents at work and a 63% fall in fatal accidents in the 15 member states for which EU-level data are available for the period. What's more, there is no statistical evidence that economies with lower health and safety standards would be more competitive. On the contrary, research by the International Labour Organization suggests that by and large the countries where working conditions are among the safest also have the best competitiveness ratings. Figures combining the selected competitiveness rankings of the International Institute for Management Development against ILO's own occupational health and safety rankings show a strong correlation between high safety and high competitiveness. EU companies depend for their survival and expansion on a committed workforce, which will only thrive in a high-quality working environment where the working conditions are safe and healthy. There is a continuous need to improve the workplace environment by investing in prevention of accidents and diseases caused by work. There are always new challenges and emerging new risks which we need to tackle. Our experience shows there is a clear role for EU-led action to help the member states tackle those challenges and risks more effectively. And now let me give you an overview about the next steps in the health and safety area in the EU. First of all, ladies and gentlemen, I would like to share a few remarks on the implementation of the EU strategy on safety and health at work for 2007 to 12. As you know, its aim was to reduce by 25% the total incidence rate of accidents at work across the EU. To meet that aim, it sought to ensure that the EU legislation is properly implemented, to support SMEs in implementing the legislation in force, adjust the legislation to changes at the workplace, promote the development and implementation of national strategies, encourage workers to change their behavior and employers to adopt health-focused approaches, and last but not least, to promote health and safety at work at international level. The final evaluation of the strategy, which the Commission will be publishing in the coming weeks, will show whether the strategy has actually managed to reduce accidents at work by 25%. The indications are that it has. But a precise assessment will only be possible once official Eurostat data are available for 2012. And that will, in principle, not be before 2014. So far, the figures available show that accident rates continue to decline. So setting a quantitative target for reducing work accidents seems to have worked. It has raised the visibility of this policy area and encouraged the member states to focus on measures to bring the accidents rate down. One of the main successes of efforts to improve SMEs' implementation of the legislation during the period covered by the strategy is the development of the online interactive risk assessment tool. This tool is a cost-free web-based application developed by the European Agency for Safety and Health at Work. It allows a growing network of partners to develop tailor-made risk assessment tools for micro and small enterprises. In particular, it helps the sectoral social partners, the employers and employees organizations, and the national authorities, such as the ministries, labor inspectorates, occupational safety and health institutes, to produce sector-specific risk assessment tools. The agency also carried out pan-European awareness campaigns on risk assessment and safe maintenance between 2007 and 2012. A campaign is currently underway on working together for risk prevention. This emphasizes the importance of leadership by top management and owners working in tandem with active worker participation in order to improve risk prevention at the workplace. These campaigns have helped to raise awareness of the need to improve occupational health and safety and mobilize the actors concerned. And the European Social Fund plays a crucial role in supporting member states' initiatives to develop a culture of prevention in the field of health and safety at work. The strategy called on the member states to make wider use of the possibilities and funding it offered for training of employees and workers in health and safety at work. In particular, it concentrated on training young entrepreneurs in occupational health and safety management and on raising workers' awareness of risk in companies and how to prevent and combat them. The evaluation of the strategy appears to endorse the value of an EU dimension to this policy area and confirm the need for a new strategy. The stakeholders considered the strategy for 2007 to 2012 highly worthwhile because it provided a framework for coordination and gave a common sense of direction. That's also true here in the United Kingdom, which has a good health and safety record. According to the latest Health and Safety Executive Annual Statistics Report, over the past decade, new cases of self-reported work-related ill health have generally fallen. And self-reported non-fatal injuries have fallen by an average of 6% each year since 2003, as estimated by the Labour Force Survey. So, ladies and gentlemen, the UK's good results cannot be seen in isolation from the EU legislation and strategies, which provide a sound basis for consistency across the single market and for preventing social dumping. That's an important consideration for UK companies and their competitiveness. The EU strategy has contributed to improving the implementation of safety and health legislation and has helped to clarify and interpret the rules. In March, the Commission will present the final evaluation of this strategy, and at the same time, it will also launch a 3-month public consultation to identify the next priorities in the health and safety area. This is in line with our policy of giving citizens and stakeholders the opportunity to put forward their views, proposals, and priorities on topics of high and shared interest. I hope you will also send contributions to this public consultation. At this stage, independently of the results of the public consultation, we are considering giving priority to tackling health issues and preventing work-related health problems more effectively. These include occupational and work-related diseases, work-related musculoskeletal disorders, work-related psychosocial risks, and potential risk of new technologies. This also includes more effective implementation of EU legislation, in particular in SMEs and especially in micro-enterprises, a special effort over the next few years to make working life sustainable. I believe we need to think about specific initiatives to promote the health and safety of older workers, facilitate healthy aging at work, and develop a culture of prevention throughout working life. At a later stage, the Commission will also conduct a full evaluation of EU occupational health and safety legislation. The findings, which are expected in 2015, will provide an opportunity for seeing how its application can be made simpler, particularly for SMEs. Europe needs to continue improving working conditions, and the future work in this area will have to reflect the broader economic, employment, and demographic situation. Ladies and gentlemen, I would like to wind up with a simple but all-important message. Investing in occupational safety and health pays, even and especially during a crisis. A safe working environment is a key factor in competitiveness, and it can help meet the EU's targets for smart, sustainable, and inclusive growth. It plays a key role in ensuring a sustainable, long working life for healthy and skilled workers. This is crucial if we want to address the problems of an aging workforce in terms of competitiveness and the financial sustainability of our social security systems. Given the current economic and financial crisis, Europe must continue to invest in the quality of work while ensuring that regulatory costs are proportionate to the benefit of adequate protection from health and safety risks, in particular for micro-enterprises and SMEs. The European Commission is and will remain strongly committed to improving working conditions. Improving working conditions is good for workers, for companies, for social welfare systems, and for society as a whole. That's why all stakeholders need to be actively involved. I thank you very much for your attention.
I think Mr. Andor will come and join us for a few minutes to take some questions. We will have people with microphones in the hall ready to run around, I hope. If you wouldn't mind, put your hand up. And just in terms of those of you at the very back, who are standing, there's half a dozen seats here, half a dozen seats there, and half a dozen seats there. So if you'd like to come into the hall, you're more than welcome. Now, do we have any questions from the floor? Yes, there's somebody over there, gentleman over there.
Good morning. Steve Perkins, Chief Executive of the British Occupational Hygiene Society. Thank you for your talk this morning, Laszlo. You quoted a number, if I remember right, of about 4,000 accident fatalities. And I appreciate that's probably an underestimate across Europe. I wonder if you have any estimates of the number of fatalities due to occupational exposures across Europe.
Well, I believe the Bilbao agency has a deeper analysis and more data. And of course, if there is any kind of breakdown of the figures which I used, we can find it and forward it to you if it's interesting. Certainly, we have to base the forthcoming strategy on such a complex analysis. So this, of course, can be helpful to explore. But I cannot give you these figures just right now.
Thank you. There's a gentleman at the front, if we can get a microphone to him. Right at the front here. This is just to keep you fit. Trying to make it as difficult as possible. I'll get somebody at the back next.
Thank you. My name is Seiji Machida. I'm Director of Safe Work Program of the International Labour Organization. Thank you for very good presentations, and we are also pleased to learn the continuation of European strategy. which is also promoted by the ILO Promotional Framework for Occupational Safety and Health Convention. Just one question is, what is the time frame for the launching of next strategy? And let me comment a bit, just for the increased emphasis on occupational health. This is also in line with what we are advocating. And this year, on 28th of April, we are observing the World Day for Safety and Health at Work. And this year's theme, we selected prevention of occupational diseases. So this is also in line with what's going on in Europe and also globally. So I'm very happy to learn your presentation, but question is, what is the further time frame?
Well, first of all, I'm very happy with our cooperation with the ILO. With Mr. Ryder, we also spoke about the importance of health and safety for the future. The time frame will be influenced by the public consultation itself. This public consultation, as I hinted to this, will cover the spring period, the spring months. But I believe that if our intention would be supported by the results, by the contributions from stakeholders during this consultation, the new strategy should be possible within this year. So this year should be enough to deliver this strategy. But again, I need to emphasize that very much depends on what the consultation will bring up from the community which is interested in this.
Thank you. Some more questions. Yes, there's a couple over here.
Yes, hello, my name is Dennis Murphy. I work for Imperial College London on the construction side, and very interested in hearing your presentation. Thank you very much. But I was just wondering, in terms of the construction workers, with the increased emphasis now on health rather than on the safety side of things, I was just wondering, is there any plans within the EU to increase the preventative measures for construction workers, especially as we have such a transitory sort of workforce? We need something structured, if you like, to ensure that their health is looked after.
Well, I would not rule out a sectoral approach to the health and safety, because it's very clear that some professions, some sectors have more accidents and work-related illnesses. If the consultation points to this, we can reflect in the development of the new strategy. There are other examples where, for example, the construction sector had some specific treatment in EU legislation, for example, on posted workers. And of course, this is very important because many workers in the EU construction sector come from other countries. They need to be better informed and better protected. And these aspects are closely connected to each other.
How do you do that, given the different, often cultural backgrounds that people come from? You know, you've got suddenly one workforce that comes from all over Europe and outside Europe too.
Well, indeed. So it means that the employers need to be able to provide this information. That requires proper communication between the employers and employees. So it probably also means that the employees need to speak the language and understand not just the signs, but also the instructions at the place. So it's probably rather complex on the ground.
All right, a work in progress. And there was somebody, yes, sir.
My name is Bruce Phillips. I'm chair of ENCHPO, the European Network for Safety and Health Professional Organisations. You spoke about the tremendous progress that's been made in the UK in reducing the level of accidents and ill health, and you went on to talk about your strategy. Many people in the room here today will be practitioners of health and safety, and they'll be thinking of the strategy that's to be implemented and wonder what their role would be in this future strategy. And I'd like you maybe to talk about that for a few moments, please.
Well, first of all, to help developing the priorities and the content of the new strategy, to identify what the key challenges are. I'm, for example, convinced that the question of aging is a major challenge, because pension systems have been reformed. The effective retirement age has increased. It means that on the one hand, the European workforce is aging but shrinking at the same time. Because of demographic reasons, less entrance to the labor market in most countries. And of course, this requires a different approach at the workplace. So the professionals, but also the employers and the employees' organizations need to be more attentive to such developments and changes, not only in designing the programs, but also at their implementation. And what I also mentioned was that the EU financial instruments, particularly the social fund, can support such programs. And this is, of course, also up to the stakeholders on the ground, the companies themselves, to look for such financial support if they consider it helpful.
Could I ask something right from the very start of your presentation? You talked about we need to do many things, especially in today's economic climate. Now, when I talk to quite a few CEOs and others, they think, in today's economic climate, I have other things that I need to do with my time and my money. So how do you focus those who are, not perhaps the people in this hall, but the people who are slightly harder to reach, who think, you know, these are really hard times. I can do something else with my time, with my company, with my business.
Yes, this is a problem we confront every day. The crisis is a time of cost cutting, especially in the consolidation period for public, but also for private finances. And there is probably a temptation sometimes to cut social costs, to cut social investment. What we stress is that, if possible, try to avoid short-termism and avoid cutting expenditures which normally should result in savings in the long term. On the top of that, also are very important to take care of the workforce and the safety of employees, but also they help preventing legal disputes and major problems that can arise from accidents at the workplace. So I think we can encourage improving efficiency rather than just cutting costs or trying to get out of a legislative framework which the EU together developed and which also helps to run a single market in the EU which is based on fair play and the level playing field.
And I suppose part of the problem about that is that you're appealing to people's sense of what is in their long-term interests, financial interests and others, but they may be thinking very short-term. I've got to get through the next 6 months, I've got to get through the next year, I've got to cut something.
Well, people, including business people, might be desperate at certain points. The point is that there is, in any case, a legislation in place that has to be met, and of course, the authorities in the given country, whether it's the UK or others, also have to act responsibly if it's necessary.
Good. A few more minutes left. Let's see. Yes, there's a gentleman there, and then there's somebody in the middle. Try again. Having trouble with that one.
Hello, hello. Oh, yes. My name is Paul Woods. I work for 6W Limited. But in previous lives, I've spent some years enforcing legislation with the Health and Safety Executive and spent many years working for BP in different parts of the world. I think your aspirations are absolutely great, but how do you ensure consistency of application across Europe? Because my experience is that we have one standard in the UK which we apply, but when I've travelled across Europe, I've seen different standards. So I don't think we're on a level playing field across Europe.
Well, the EU legislation in most cases are about minimum standards. And since the member states together approve this legislation, they are also responsible for the implementation. If it's violated, we have the capacity to enforce. And if there are cases when there is a problem, of course, the Commission is given information, and we can come to the member state, discuss it, and show that the practice improves and the standards are improved. Member states can build on that, can also add, if they wish so, to the EU legislation. So the minimum means that there is a floor under which you cannot go, but some member states, if they wish to add more to that and have even higher standards, they are free to do so.
Are you suggesting that there's some states that don't even comply with the basic floor?
Well, without mentioning particular companies or particular countries, when I've been travelling to fabrication sites in Europe, I've been told that that legislation doesn't apply to us because the workforce have voted not to have it applicable. Likewise, I've been told that the directors don't think it's relevant, therefore they don't apply it.
Right.
I don't know whether that's the experience of other people, but certainly that doesn't apply in the UK, but I've come across it on a number of sites overseas. Not outside Europe, but in Europe as well.
Is that a problem that you recognise? Perhaps particularly with new accession states, it's difficult to meet the standards quickly, or at all?
If it is difficult to meet the standards immediately, there are transition periods in certain cases. But normally, when the legislation is in place, it has to be implemented, and the member state is responsible for that. So there is, of course, the appropriate procedure if there is any evidence of violating the rules.
Right, and I think we've got time for one more question. Yes, gentleman there.
Jem Sarden, City and Guilds. Does the EU Commission have a view on the Lofted report and the UK government's strategy for reducing legislation and which they see as a barrier to SMEs, which perhaps conflicts with what you were saying earlier on in your talk?
Well, of course, we try to follow the discussions inside the UK about these issues, employment policy, employment legislation of the EU, whether it represents a burden or not. But we have to respond to official statements rather than newspaper coverage or very colorful language sometimes about social legislation in the EU. So officially, we haven't received much. The UK plays a constructive role. I can give you recent examples on the exposure to electromagnetic fields and other cases where the approach is practically the same when it is about the work in the council or the implementation of the existing legislation. So we somehow try to separate the language which sometimes is used in the media, and was on the one hand, and on the other hand, the actual work and the functioning of this legislation, which I would say is just normal.
Okay, we'll leave it there. A warm welcome and thank you very much, Laszlo Andor. Thank you. Pleasure.